All right, let's dive into something super important for all you future nurses out there, the nursing diagnosis process.
Ooh, yes, the nursing diagnosis process.
And it's not just, some boring textbook stuff. This is
Right.
like actually the secret sauce to giving your patients amazing care.
It is.
So
yeah.
let's start with the basics. What is a nursing diagnosis? I mean, we all know doctors make medical diagnoses, but how's a nursing diagnosis different?
Well, you're right. That is a great place to start. And it really highlights what makes nursing unique.
Okay.
So doctors focus on diagnosing and treating diseases, but nurses, we focus on the person's experience of that disease,
Oh, okay.
their responses, both physical and emotional.
So say someone comes in with a heart attack.
Right.
The doctor's diagnosis is going to be, the medical term, all official. But the nurse's diagnosis could be something else entirely.
Yes, you're exactly right.
Okay.
The doctor might diagnose myocardial infarction, but we as nurses, we're looking at how that heart attack is affecting that individual person. So we might identify nursing diagnoses like acute pain, activity intolerance, or even anxiety, just based on what we're seeing, the patient's reactions.
So it's like two sides of the same coin. The doctor treats the disease and the nurse treats the person who have the disease.
That is a great way to put it.
Okay.
And these nursing diagnoses, they're not just, random labels we're throwing around.
Right.
This is the foundation of everything we do as nurses.
Oh, wow.
They guide our assessments, our interventions, and they ultimately help us provide truly personalized care.
Okay, so now I'm really seeing why this is such a big deal.
Yes.
But I got to be honest, when I first learned about nursing diagnoses back in school, it was kind of overwhelming. There were just so many possibilities.
Right.
And it's hard to even know where to start.
I totally understand that feeling.
Yeah.
But trust me, over time, you develop this sixth sense for spotting those key patient responses. Okay. You can think of it kind of like detective work, right?
Ooh.
You're gathering clues from their story, the physical exam, lab results, and you're putting all those pieces together to paint a full picture of their experience.
So the textbook talked about nurses analyzing data and identifying red flags.
Yes.
So we're always on the lookout for those little cues.
Exactly.
That could mean there's a problem.
Yes, and it's important to remember a single cue
Right.
doesn't always mean there's a problem.
Okay.
It's more about looking for clusters of data, those patterns that emerge when you consider all the information together.
So the book used this example of a crying patient. Just because someone's crying
Right.
doesn't automatically mean they have a coping impairment diagnosis.
Exactly.
There could be tons of reasons why they're crying.
A million reasons, yeah.
Right. Okay.
So it's important not to jump to conclusions based on just one thing.
Okay.
We have to be super thorough, gather all those facts, and then look for the connections that help us see that bigger picture.
But how do we know what's actually a problem
Right.
for a patient? Because what's normal for one person
Absolutely.
might be a red flag for someone else.
Yeah, you're absolutely right. And that's where critical thinking is so important.
Okay.
So we have to consider the patient's age, developmental stage, cultural background,
Right.
all the things that make each person unique.
So something that might be a concern in a young, healthy person
Yeah,
could be totally normal for an older adult.
exactly.
Okay.
It's all about understanding that normal is relative, right? We're always comparing what we observe about the patient
Yeah.
to what we would expect for someone in their particular situation.
Okay. So we've talked about how nursing diagnoses focus on those patient responses
Right.
and how we gather all that data to identify them.
Yes.
But here's where I start to get a little confused. There are different types of nursing diagnoses.
Yes, there are.
Right.
There are.
Can you break those down for us?
Of course. And don't worry, it's not as complicated as it might seem.
Okay.
We can divide nursing diagnoses into three main categories.
Right.
Problem-focused,
Great.
risk, and health promotion.
Okay, so let's start with problem-focused.
Okay.
So does that just mean the patient's having a problem right now?
Yes,
Yeah.
exactly what it means.
Okay.
It's the most straightforward type.
All right.
So a problem-focused diagnosis describes an issue that's actively happening right now. So think about a pressure ulcer.
Okay.
It's a present, observable problem.
Right.
So the nursing diagnosis might be impaired skin integrity.
Gotcha. Okay, what about risk diagnoses?
Okay, so risk diagnoses, these are all about identifying vulnerabilities.
Okay.
It means the patient doesn't have the problem yet,
Okay.
but they're more likely to develop it
Right.
based on, their circumstances or their health history.
So like an older patient who has balance problems
Yes.
might have a risk for falls diagnosis.
Perfect example. It's all about being proactive and putting things in place to try to prevent that fall from happening.
Right.
And then finally, we have health promotion diagnoses.
Yeah.
And this is where things get really interesting.
Oh, I like the sound of that. So it's not about a problem.
Not necessarily, no.
So more about like helping the patient be their best selves.
Yes, exactly. Health promotion diagnoses focus on the patient's desire to improve their well-being.
Okay.
So, for example, imagine someone who wants to start eating healthier.
Mm-hmm.
Their nursing diagnosis might be readiness for enhanced nutrition.
Gotcha.
So we're there to support their goals
Okay.
and help them make those positive changes.
This is starting to make a lot more sense.
Good.
So we have these 3 different types of diagnoses.
Yes.
Each one needs like a slightly different approach from the nurse.
Exactly.
But how do we actually write a nursing diagnosis?
Yeah, that's a great question.
Like how do we go from gathering all this information to actually writing it down in a way that's clear and concise and helpful?
Mm-hmm. Well, that leads us right into the nitty-gritty of the diagnostic process. So
Okay.
why don't we pick up right there when we come back?
Sounds good to me. All right, so now we're going to get into the like really hands-on part of this.
Yes.
Actually writing those nursing diagnoses.
Yes.
And I remember like when I was a nursing student,
Mm-hmm.
this is the part that really tripped me up.
Yeah, I bet.
All those care plans
Mm-hmm.
and just blank spaces staring back at me.
Right.
It was intimidating.
I can totally relate to that.
Yeah.
It does feel like you're trying to like learn a whole new language.
Right.
But the good news is
Okay.
there's a pretty standard structure to nursing diagnoses.
Right.
And once you get that,
Yeah.
it all starts to make a lot more sense.
Okay, so let's break down that structure. What are the essential parts of a well-written nursing diagnosis?
Right. So think of it like a three-part puzzle.
Yeah.
We've got the problem,
Okay.
the etiology, and the signs and symptoms.
All right, so let's start with the problem.
of
Is
the-
that just like a fancy way of saying what's wrong with the patient?
It's a little more specific than that.
Okay.
The problem in a nursing diagnosis, it's a concise statement
Okay.
that describes the unhealthy response that the patient is experiencing.
Okay.
So it's what we as nurses are trying to address and improve.
So if a patient is, say, having trouble breathing,
Right.
the problem might be ineffective breathing pattern.
Perfect example.
Okay.
Now, the etiology,
Okay.
this is where we dig a little deeper.
Okay.
It's all about figuring out what's causing the problem.
Mm-hmm.
What are those underlying factors
Right.
that are contributing to that unhealthy response?
So like we're playing detective, not just like, oh, they can't breathe.
Exactly.
Why can't they breathe?
Right, you got it. And
Okay.
this is super important because understanding the etiology
Okay.
really guides our interventions.
Okay.
Because if we get the cause wrong, we might end up just treating the symptoms
Mm.
without actually addressing the real issue.
Right, which doesn't really help the patient.
Exactly. Not very helpful.
So for our patient who's having breathing problems,
Right.
the etiology might be like related to anxiety or related to pneumonia,
Mm-hmm.
depending on like what we find during our assessment.
Exactly. You're getting it.
Okay.
Now, the final piece of the puzzle
Okay.
is the signs and symptoms.
And, this always seemed a little redundant to me
I know.
because we've already like gathered all this information. So
Right.
why do we have to write it down again?
I know it seems a little repetitive,
Yeah.
but trust me, it serves a really important purpose.
Okay, so tell me, why is it so important to like actually list those signs and symptoms within the nursing diagnosis?
Okay, so it's all about validation and clarity.
Okay.
So it's our chance to really connect the dots and show how the evidence we've gathered supports our clinical judgment. It's also super helpful for communication and evaluation.
Mm-hmm.
So by including those specific signs and symptoms,
Okay.
everyone involved in the patient's care is literally on the same page.
So it's like we're saying, okay, here's the problem.
Yes.
Here's why we think it's happening.
Exactly.
Well, here's the proof.
You got it. It's all about transparency
Okay.
and making sure our clinical reasoning is, rock solid.
Okay.
And speaking of making sure our reasoning is sound,
Right.
let's talk about some of the common mistakes that I see new nursing students make.
Oh, yeah, the textbook had some funny ones.
Oh, there's some classics in there.
It's amazing, like, how easy it is to mess this up.
It is.
Just get tripped up on the wording, and then it's like, oh, that's not really nursing diagnosis.
Right.
Yeah.
So one of the biggest pitfalls I see is writing the diagnosis as a patient need instead of a patient response. So, for example, you might see something like, patient needs help with bathing. Right. So instead of like focusing on what the patient's response is, which might be like self-care deficit.
Exactly. Related to whatever the cause is.
Yeah.
Another common mistake is using language that's not appropriate for a nursing diagnosis.
Right.
And it's really important to remember that our documentation, you can have legal implications.
Right.
So we really need to be careful with the words we choose.
So we can't just write patient's grumpy because the hospital food is terrible.
Well, I mean, we do have to stick to that clear, objective language and really focus on those patient responses that we as nurses can actually do something about.
Gotcha.
Now, there's another really crucial aspect of this process that I want to highlight.
What's that?
And that is partnering with the patient.
Oh, yeah. This is something that really struck me as I was reading about all this. It seems like nursing has really changed.
From that old school model where it's like, the doctor's in charge and the nurse just follows orders.
It was very hierarchical.
Yeah.
And it's definitely a welcome change.
Yeah.
Now we recognize more than ever that patients are experts in their own experiences, and their insights are so valuable in coming up with those accurate and relevant diagnoses.
It's about collaborating.
Yes.
Not just like watching and taking notes.
It's a partnership.
Okay, so it's not just about collecting data. It's about actually talking to them.
Yes.
Asking them questions.
Absolutely.
And trying to see things from their point of view.
Exactly.
Okay, I can see how that would make the care so much better.
Absolutely. It's about respecting their autonomy.
Right.
Building trust, making sure the care plan really aligns with their values and their goals.
So good communication is really key here.
It is absolutely essential.
Okay.
Take the time to really listen to your patients. Ask open-ended questions and really try to see things from their side of it.
Now, what about those situations where the nurse and the patient disagree?
Oh, yeah, great point.
About like what the problem is.
Yeah, that happens all the time.
Yeah. How do you handle that?
It all comes down to communication, active listening, and a willingness to be flexible.
Okay.
Sometimes it's about finding a creative solution that addresses both the patient's concerns and the nurse's professional judgment.
Right.
But, that's a whole other deep dive for another day.
Ooh, can't wait. So I remember the textbook also mentioned this thing called NANDA. What is that?
Okay, NANDA.
Okay.
Think of it as your best friend as a nursing student.
Okay.
It stands for the North American Nursing Diagnosis Association International.
Okay.
And they've put together this amazing standardized list of nursing diagnoses that are used all over the world.
So it's like a giant dictionary of nursing diagnoses.
Exactly. Yeah. So it gives you clear definitions, defining characteristics, related factors for each diagnosis, which helps make sure that everyone is using the same language.
Right, like we're all speaking nurses.
Yes, exactly.
Yeah. Okay.
So if you're ever feeling unsure about a particular diagnosis or how to write it correctly, NANDA-I is an awesome place to start.
Okay, so it's helpful for like brand new nurses.
Yeah.
But also like people who've been doing this for a while.
Absolutely. It's a valuable resource for nurses.
Why?
At all levels of experience.
Okay.
But remember, NANDA-I is a tool, not a crutch.
Yeah.
We still need to use our brains, our critical thinking skills, and actually apply those diagnoses to real-life patient situations.
Okay.
It's like learning any new language.
Right.
It takes time, practice, and immersion to become fluent.
I love that analogy. So it's not about just like memorizing a bunch of terms.
Right.
It's about like learning how to use them properly.
Exactly.
Yeah.
Now, before we wrap up this section, I want to emphasize, developing these skills, it takes time and practice. So don't get discouraged if you don't feel like an expert right away.
It's reassuring, yeah.
Yeah, I mean...
But I'm sure even experienced nurses still, like, second-guess themselves sometimes.
Oh, absolutely.
Yeah.
Even the most experienced nurses, we consult with our colleagues.
Right.
And we use resources like NANDA-I to make sure we're on the right track.
Right.
It's all part of the learning process.
Well, this has been so helpful.
Good.
I already feel like way more confident.
That's great.
About tackling these nursing diagnoses. But before we wrap up this whole deep dive, I have one more question for you.
Okay.
What's the most important thing that new nursing students should remember as they start putting all of this into practice?
Well, that's a great question.
Oh, yeah.
And it makes me think back to my own experience as a brand new nurse.
Yeah.
I think the biggest piece of advice I would give is don't be afraid to ask questions.
Oh, that's such good advice.
It is. Nursing school gives you the foundation.
Right.
But real mastery comes from experience.
Yeah.
And that means being open to learning from every patient, every colleague, every situation.
Yeah, it's like you can read all the textbooks.
Right.
But there's nothing like that aha moment when you're actually working with a real person.
Exactly. And those aha moments often come from collaborating with others.
Okay.
So don't be afraid to bounce ideas off your fellow nurses.
Right.
Ask for feedback on your diagnoses or consult with those more experienced nurses.
So it's really all about teamwork.
It's all about teamwork. Yep. We are not in this alone.
Yeah.
And speaking of teamwork, one of the most important partnerships you'll form is the one with your patient. Remember, the nursing diagnosis process, it's not about slapping a label on someone.
Right.
It's about understanding their unique story and working with them to come up with a care plan that really meets their individual needs.
So communication.
Yes, it is absolutely essential. Take the time to listen, ask open-ended questions. And try to see things from their perspective.
All right, so we've covered a lot in this deep dive.
Well, you have.
We talked about what nursing diagnoses are, how they're different from medical diagnoses.
Yes.
The different types and the steps for writing them correctly.
Right.
So before we wrap up,
Okay.
Is there anything else that's like really crucial for new nurses to know about this whole process?
You know, I think it all boils down to this one key idea.
Okay.
Nursing diagnoses are powerful tools, but they're just that. Tools they should never overshadow the human element of nursing. Always remember that you're caring for a whole person, not just a list of symptoms or a label.
That's so important to remember.
It is.
It's easy to get like really focused on the technical parts of the job.
Right.
But at the end of the day, it's about compassion.
Yes.
Empathy.
Absolutely.
And connecting with people.
Yes. I couldn't have said it better myself.
So for all you new nurses out there who are maybe just starting to learn about all of this, embrace the challenge, ask all the questions.
Ask all the questions.
Don't be afraid to ask for help.
Right.
And never lose sight of that human connection.
Yes.
Because that's really at the heart of what we do.
It is.
Well said.
Thank you.
And to all our listeners, thank you so much for joining us on this deep dive into the world of nursing diagnoses.
We hope it was helpful.
We hope you learned something new.
And maybe even a little inspiring.
Until next time.
Keep learning.
Keep growing.
Keep caring.
That's a great question. And, you know, it makes me think back to my own experience as a newbie nurse. I think the biggest piece of advice I'd give is don't be afraid to ask questions.
Couldn't agree more. Nursing school gives you the foundation, but real mastery comes with practice, and that means being open to learning from every patient, every colleague, every situation.
Yeah, it's like you can read all the textbooks in the world, but there's nothing quite like that aha moment that happens when you apply what you've learned to a real person right in front of you.
Exactly, and those aha moments often come from collaborating with others. So don't be afraid to bounce ideas off your fellow nurses, ask for feedback on your diagnoses, or consult with more experienced colleagues.
It's all about being part of a team, right? We're not in this alone.
Absolutely. And speaking of teamwork, one of the most important partnerships you'll form is the one with your patient. Remember, the nursing diagnosis process is not about slapping a label on someone. It's about understanding their unique story and working with them to develop a care plan that meets their individual needs.
So good communication is key.
It's absolutely essential. Take the time to truly listen to your patients, ask open-ended questions, and try to see things from their perspective. Sometimes the most valuable insights come directly from the people we're caring for.
That makes so much sense. So we've covered a lot of ground in this deep dive. We've talked about what nursing diagnoses are, how they differ from medical diagnoses, the different types of nursing diagnoses, and the steps involved in writing them effectively. But before we wrap things up, is there anything else you think is crucial for new nursing students to grasp about this process?
I think it all boils down to one key idea. Nursing diagnoses are powerful tools, but they're just that, tools. They should never overshadow the human element of nursing. Always remember that you're caring for a whole person, not just a collection of symptoms or labels.
That's such an important reminder. It's easy to get caught up in the technical aspects of nursing. But at the end of the day, it's all about compassion, empathy, and building genuine connections with the people we serve.
I couldn't have said it better myself. So to all the nursing students out there who are just starting to grapple with this concept, embrace the challenge, ask tons of questions, and never lose sight of the human connection that lies at the heart of nursing care.
Beautifully said. And to all our listeners, thanks for joining us on this deep dive into the world of nursing diagnoses. We hope you found it informative, engaging, and maybe even a little bit inspiring. Until next time, keep learning, keep growing, and keep caring.